Oh. Imagine your loved one being taken away in an ambulance for a medical emergency. Do you think that's the last you'll see of them? Do you trust the medical personnel? Are you already planning your loved one's funeral arrangements? Polish paramedics and physicians break that trust and more. Skin Hunters, tonight on 10 Minutes.
Good evening. In January of 2002, it was brought to public attention that emergency medical personnel in the central city of Łódź, Poland, had been accepting bribes of up to $300 per person in order to guarantee funeral homes first access to the information of those that were deceased. In many circumstances, prescriptions were forged for a potent muscle relaxer that resulted in the intentional overdose at the hands of those deemed the Skin Hunters.
That's right, Kelsey. The conspiracy started as early as 1990, and those involved were thought to be responsible for up to 5,000 deaths. The medication responsible for the demise of those affected was pancuronium bromide injection.
Oh, I've got another one for you. This will feel just fine. Good. Got your body. Okay. Should be all there. Thank you, sir.
Pancuronium bromide is a non-depolarizing neuromuscular blocker agent. Its uses include facilitation of endotracheal intubation and relaxation of skeletal muscle during surgery. It is also used for facilitation of endotracheal intubation in ICU patients. It does carry a black box warning that it should only be administered by adequately trained individuals familiar with actions, characteristics, and hazards of the drug. As you can see, pancuronium bromide shares similar pharmacophore with acetylcholine. They both contain an ester, a 2-carbon linker, and a quaternary amine.
Pancuronium bromide competitively inhibits nicotinic acetylcholine receptors, blocks neurotransmission of myoneural junction at binding with cholinergic receptor sites. It does not relieve pain or promote sedation. Stop that. No, you can't have that.
That's dangerous! What are you doing?
Somebody's got to pay the rent.
At this moment, the victim was injected with an overdose of pancuronium bromide. This created muscle weakness, decreased respiratory reserve, and eventually paralysis.
Yes, an overdose of this medication can result in the paralysis of the diaphragm and of the intercostals, resulting in asphyxiation.
Without mechanical ventilation, this person will die.
On the positive side, there is a cure. You first start off with supportive care of the patient.
And then you establish an airway with protection and ventilation support.
You can sedate the patient with benzodiazepines or opiates.
Monitor vital signs, especially respiratory.
You can obtain an ECG and continuous cardiac monitoring.
Use an acetylcholinesterase inhibitor such as IV neostigmine, physostigmine, or idrophenium.
You can administer atropine before neostigmine to counteract its muscarinic side effects.
And you can manage hypotension with fluids and vasopressors if unresponsive to fluids.
Gastric decontamination is not recommended in these patients.
Go to 10minutesovertime.com for more information and new breaking stories. Next week, tune in for Brent Davis, budding pharmacist or criminal mastermind.